Hello and welcome to this presentation on the physiotherapy programme at Ulster University. My name is Leslie George. I'm one of the physiotherapy lecturing staff and will also be the incoming course director for the academic year 2022-2023. Hopefully during this presentation I'll give you some idea about what it's like to become a physiotherapist. Obviously, having qualified via Ulster University some 15 years ago, it's an area that I'm particularly passionate about, and the rest of the academic and lecturing staff are also very passionate about. We do hope that this gives you a flavour about what is involved within the course, some of the support that we may provide you as you embark hopefully on the journey with us at Ulster University. Obviously, it's new and exciting times for us as we move to our new home on the Magee campus, which is obviously located in the heart of Northern Ireland's second city, Derry, Londonderry. And obviously some of you will be from that area and you'll have more experience about the vibrant nightlife, etc., that there is around here. But obviously this is a very exciting time for health sciences as we move there, and we also will be positioned there alongside the School of Nursing and the medical school as well. We do know it's one of the most affordable places to live within the UK, and hopefully as a student you see that as a vibrant and viable option for you to come and study with us at Ulster University. In terms of what physiotherapy is, obviously it's an area that I'm very passionate about. There's more to life than simply breathing and having a pulse. Physiotherapists help to maximize the quality of life for our patients and clients, okay? And certainly that makes me feel really fulfilled. So obviously it's a vital cog. Some of you, I'm sure, have some experience of family members, friends, working within the NHS. Maybe some of you already work within healthcare, so you'll have some idea of what is involved within physiotherapy. And hopefully during this presentation I can give you a bit of a flavour from my background, but also in other areas of physio. It's a very wide scoping and wide array of different areas that physiotherapists can specialise within. So obviously the BSc physiotherapy a course and the overview is about helping people affected by injury, and that can be a wide array of different injuries, whether it's neurological, respiratory. When I say neurological, I mean after stroke, after maybe someone with Parkinson's disease, after a traumatic brain injury. Also, obviously, you'll be helping people who maybe have low back pain, who have musculoskeletal pain, shoulder pain, etc. And obviously, that's the area of physiotherapy that most people are aware of. But there's so much more to physio than just that. You can help people after diagnosis of cancer. You can help people with breathing difficulties, and again I'll expand on that in due course as we go along through this presentation. You'll learn how to assess and diagnose problems, to recognize all the aspects of health and disease, and to work alongside other healthcare professionals. So obviously we very much operate as part of a multidisciplinary team, working with our colleagues in occupational therapy, podiatry, and all the other nurses, doctors, whatever it may be, the different professionals that we come across both within the NHS sector but also the private sector as well. I'll talk to you a little bit about teaching and the assessment and the different learning environments. I'll come on to that in due course, and also the real world experience. Okay, obviously it's very much built around clinical placements to augment the learning that you gain in university. Your career opportunities are wide ranging. You can become a physiotherapist in a range of different sectors. You can become a researcher, rehabilitation specialist, you become a manager, private practitioner, and you can also become a leader in healthcare delivery as well. Our course is accredited by the Chartered Society of Physiotherapy, which is our professional body, and they very much set the standards that we require both as physiotherapists but also in terms of the education that we provide to yourselves as potential students. So we're going to cover hopefully and give you a flavour of why maybe you should study physiotherapy at Ulster University. What is a physiotherapist? What will you learn? How will you be taught? How will you be assessed? How we will support you as a group of healthcare staff. How maybe as students you can support you, but also the institution in terms of the university-wide support that is there for you as students as well, and what future careers there are. So what is a physiotherapist? It's obviously very much a caring profession. It's a science-based profession and takes a whole person approach to health and well-being, which includes the patient's general lifestyle. And that comes from our professional body, the Chartered Society of Physiotherapy. So we look very much at the patient's physical abilities, but also maybe thinking about their health and well-being from a psychosocial standpoint in terms of their mental health and well-being after significant injury, whether that be after a stroke or after a significant road traffic accident, after a musculoskeletal injury, maybe a sports injury, whatever that may be. We very much take a whole person, or what we call holistic approach to our patient care and management. So in terms of a graduate physiotherapist, it's a 3-year course, and we do hope that we produce physiotherapists that are going to promote and really benefit the profession and really look after the patients at the end of that journey and also through the journey. Ultimately, we want students that can identify problems that need a solution, they can source the relevant information, they can critique and appraise, and they can look at that information, and they can identify solutions for the patients, for example, based on the evidence. So what there is in terms of the research, plus your own original thoughts. So how do you feel you can help that person holistically? How can you improve their quality of life? How can you maybe return them to their previous level of function, in terms of maybe returning to sport or returning to other activities that they maybe do in their day-to-day lives? Okay. We also want you to compile and deliver reports and presentations in the way that can be understood by a variety of different audiences. So for example, you might present to patient groups, or you might present to other colleagues and other professionals then as well. Okay, so the graduate physiotherapist is an autonomous practitioner, so hopefully you'll be able to practice independently. You'll be a critical thinker, you'll be able to look at those problems, work your way through them and problem solve. Obviously it's there's professional requirements by the CSP, and also by our governing body, the Health HCPC as well. Very important that you work as part of a team. Okay, obviously the more we can work as a team, the better it is for our patients in terms of their outcomes. We want you to have good clinical skills, but also good academic qualities as well, in terms of maybe potentially writing up research or being involved in research studies as well. And very often some students go down that in terms of progressing on to PhDs and also masters and other research projects that they're involved with within physiotherapy, but also in a much wider scale as well, in terms of promoting physical activity, etc., and other key areas as well, in terms of stroke prevention, etc. So what are the pros and cons? Obviously I'm biased, but some of the pros are it's a great career and one that I'm very happy that I've chosen. You get to help people, which is just fantastic. So some great stories over my 15 years so far, in terms of being able to help people and get them back to an acceptable level of function for them. Obviously it's very good from the professional standpoint, and obviously you have the potential to progress from a junior physiotherapist to a senior physiotherapist to clinical specialist, and then branching on into other key roles as well. What are the cons? Everyone has a problem. So every family event that you go to, if anyone knows that you're a physio, you'll get to hear about their back problem, their neck problem, and every other little problem that they have. But again, it's nice to be able to help people. Okay, obviously as well, there's an expectation that you stay professional when off duty, and that goes without saying. But again, with that there does come some pressures as well, particularly if you maybe work and live in the same area as well. So please do that, bear that in mind. There are specific requirements around us maintaining our professional registration, and obviously there are requirements within that as well. In terms of the salary, obviously this just shows you some examples of the types of salaries that you might come across. If you were to qualify as a physiotherapist after 3 years and become a band 5 physio, then this shows you the approximate range, and this is changing all the time, the approximate range of what we would traditionally classify as a junior physiotherapist, but a band 5 rotational physiotherapist, where you move around different areas between sort of 25 and 30 to 31,000 pounds. Band 6, in old money terms, as a senior physiotherapist, you become more experienced and you start to specialise in a particular area. Your salary might be between 31 and 38,000 pounds. Band 7, Band 8A, then you're working more up in towards the different clinical specialist type areas, and you can see then it starts to move up to a salary of over 51,000 pounds. And that is very much in terms of the NHS setting. Obviously, the salary in terms of the private setting is very different and has quite a wide range of salary implications depending on your experience, depending on whether you work for yourself or you work for someone else as well. As I said, it's a very much ever-evolving profession. The traditional areas of physiotherapy, very much people come into physio and come into the musculoskeletal field, and this is very often when you ask people what physios do, they'll understand that we deal with back pain, sports injuries, arm pain, but there's so physio than that. There's the cardiovascular components, working with people with chronic heart disease, cardiac rehabilitation, which is exercise classes for people with heart conditions, respiratory, working with patients with asthma, COPD, cystic fibrosis, and rehabilitation, again trying to promote physical activity and make the patients as fit as possible. Patients with neurological conditions such as strokes, MS, Parkinson's disease, muscular dystrophy, and very much ever-evolving roles, as very much now we have more and more clinical specialists working within A&E, first contact practitioners within GP practices, within cancer care, and also within respiratory care. So there is a huge potential to develop and evolve, and obviously we want to try and encourage our physiotherapists who graduate from Ulster University to promote the profession and really branch out into these key areas where they can promote the profession. So what will you learn? Obviously you learn lots, but very much obviously it's key that you have a real good understanding of anatomy. So what's in the body, the physiology in terms of how it works. So thinking if you do biology, for example, about energy systems, how can we rehabilitate the body? What do we need to consider when we're rehabbing our patients? What about the pathology then? So how can it go wrong? So if we think about musculoskeletal conditions, why does someone present with back pain? Why did someone roll their ankle? Why did someone hurt their shoulder? And how can we rehabilitate that? So what treatments? How do we fix it? How do we help our patients? How do we restore their quality of life? We need to have a good understanding of psychology and sociology, how to help patients help themselves. Obviously, you'll hear the old adage, prevention is better than cure. As physiotherapists, it's vitally important that we promote physical activity and exercise. We know that we're all starting to lead much more sedentary lifestyles now compared to in the past. So again, how can we promote exercise and the benefits of exercise to reduce heart and lung disease, for example? What are the barriers for the patients to doing this? And then what general academic skills? So can you look at the research and can you write up pieces of work? Can you write up assignments? Can you do presentations? And then obviously research skills. It's vitally important as physiotherapists that we have good research skills and we look at the research and provide the best standard of care that we can for our patients. So in terms of your learning, the great thing about physio is you will learn in a variety of different ways. Obviously, it's a very hands-on course. There's a lot of practical face-to-face. Now that has been impacted by COVID, but still very much in terms of physiotherapy, you will do a lot of hands-on practical face-to-face, learning the body, learning how the body moves. You will also have lectures and seminars. Some of these we have learned from some of the things that we've utilised over COVID-19. So some students do continue to like some lecture materials to be provided online. They maybe don't want to come onto campus just for an hour. So they might like the fact that they can watch some lectures recorded, for example. Some of those lectures are delivered live, synchronous or asynchronous, where they're recorded. And there's pros and cons to both approaches then. It's very much a progression from year 1 to year 3, from very much directed as you come into the profession, and then we hope by year 3 you're much more independent. We're directing you towards the learning, and that's very much the case in university life in general. We do try and support you as best we can, but obviously as you progress through, we want you to be more independent and more autonomous and to be able to carry a lot of this learning by yourselves. So it's a 3-year course, and it's very much supported by clinical placements, as you will see here. In year 1, you're taught the fundamentals. You have 1 week orientation in year 1, as you can see, after Christmas time, and then you've got a 5-week placement then in the sort of summer period then in year 1. And year 2, you can see then in second semester, okay, and university life split down into these semesters. Semester 1's from September to Christmas time, and then the end of January then to May, June time is semester 2, and you can see there's a 6-week block there. And then you can see as you move into year 3, again, now that you have the fundamentals and you're starting to understand the process and skills, you're starting to apply that knowledge in your placement much more regularly. So as you can see in final year, then you have 1 placement there in the summer before final year, and you also have then the 2 different placements then within year 3 as you progress through and develop your learning. So how will you be assessed? Again, we use a mixture of assessment types. So you might have class tests as you move along. You might have OSCEs, whereby you've practical skills tests, and that's very commonly utilised in physiotherapists, where we'll ask you to maybe assess a patient, come up with a treatment plan. For example, in musculoskeletal care, we might ask you to assess someone's shoulder and maybe come up with discuss through some tests that you might use with the patient. We might ask you to do some presentations, and again, that's vitally important. You develop those skills. You may do oral tests, you might submit videos, essays, and then the final piece of work, or the big piece of work that students commonly refer to then as their dissertation. And again, that involves you writing in an academic sense, and again, you know, really that is the end, I guess, of your third year, whenever you'll be doing that through your 3rd year. So there's a wide array of assessment techniques. In terms of pastoral care and learning support, we're very much here to support you. Okay, we know going to university is very different from school life, from A levels, from if you're coming from a technical college or whatever background you're coming from. Everyone is allocated a studies advisor. Okay, he will support them and meet them, particularly through their first semester and second semester of first year, but we'll continue to meet them as they go along, and they're very much there to support you in any way that we can. We very much have an open door policy. We do hope that students feel that they can contact us if there's any issues. Student support services are also very much there to support you where you can. There's also placement educators. So when you go in placement, you'll have a placement liaison, which is an academic member staff who will support you, but there's also someone who oversees that within the university. But you also have educators when you're on placement. You'll just not be left to your own devices, and they are very much there to support you. There's online resources. We use the Blackboard Learn platform. That's what we use at Ulster University, and there's library resources that we will also direct you to. So we do hope that we have a good support network, and we really do try to support our students as best we can whenever they embark on university life. Also, some miscellaneous things to be aware of. Obviously, we have entry requirements, medical examinations, vaccinations. It's important that you're up to date with your vaccinations, obviously, because you're working with people potentially from vulnerable backgrounds, and also just generally because you're working with the general public. You'll be subject to a police check. There's also the fact that you have to participate in practicals, so there is a requirement for you to undress. Okay, for example, if we're trying to teach anatomy and palpation of some of the muscles around the shoulder or around the knee, it's important that you're happy to undress to a suitable level. And also there's a significant time commitment. Physiotherapy, I'm not going to sugarcoat it, unfortunately, it is demanding in terms of your time. We want to produce the best quality physios that we can. So there's a certain, whereby other courses there might be less of a requirement for you to be in class. There is certainly a requirement for you to be in class, whether that's on campus or remotely, but also then to continue with your learning outside of that. And each semester is split down into these different credits. To go through a semester, you need 60 credit points, and then the university and universities in general equate that to 600 hours of work from your point of view, both in class and outside of class. So again, there is a certain demand in terms of your time, but it is a very very, very rewarding profession. And the more that you learn, the better it is for your patients ultimately, and better for yourself in terms of your job satisfaction. So why study at Ulster University? We do have hopefully a large staff size. We do have experts teaching in their own fields, so we do teach in our own areas of expertise. We're very much a friendly and cohesive staff group, but we also have friendly and cohesive student groups. You will spend time in your practical groups, for example, and you will spend time in physical practical classes. So you will get to know your colleagues, and hopefully you find that as a good support network. We were the first UK physiotherapy course in the and we set up in 1976. So hopefully by this stage we know what we're doing, and our course is continually revalidated, and obviously we're monitored then by the CSP in terms of the students that we produce and how we're adhering to the various guidelines that we have to. We have a history of widening participation and excellence in teaching. We're innovative in terms of our module contents, in terms of our assessment formats. We constantly listen to student feedback in terms of how we can improve things for our students, in terms of National Student Survey, etc. And again, the fact that you're out in placement within Northern Ireland means you can become familiar with local employers as well. And I think that's very beneficial. And Ulster students graduate earlier than most as well, and can progress then earlier into the job market. And certainly we do know at the minute, due to changes within the NHS and new and exciting roles within their NHS, there is a big requirement for newly qualified physios, and hopefully that very much continues. So in terms of the COVID-19 pandemic and the impact, obviously, without going into this in very much detail, this is a constantly evolving situation, and we will very much be more face-to-face than we were during the pandemic. But as I said, we have learned from some of the factors that students have found particularly beneficial. As I alluded to before, you know, not always do students want to come on for a 1 hour face-to-face lecture. They may wish to have some form of remote learning at points, and again we try and balance that in terms of again optimizing your learning as a student group. So we will use lectures and seminars and a combination of practicals as well. So as I talked about earlier, our courses are continually reviewed to take advantage of new teaching approaches and developments in the research within the industry and the professions. Okay, modules may change from year to year when we revalidate the program, which is usually every 4 to 5 years. There may be some changes from that perspective, and the exact modules available in their order may vary depending on course update, staff availability, timetabling, and student demand. Obviously, we did have to make some changes during the COVID pandemic, but we hope to go back to a more normal delivery model again. If you need any further information, please do not hesitate to get in contact with any of the course team, which is available on the Ulster University website. And then just generally, obviously in terms of entry requirements, they are very much published on the website, and it'd be too much for me to go through here now. And the best people to get in touch with when you're considering that is the admissions team. So admissions@ulster.ac.uk. If you've any queries, please do get in touch. They are your best point of contact. And then obviously we do hope that you will be applying and do find Ulster University a very inviting university to apply towards. We do very much love the course that we deliver. We're all very passionate physiotherapists. We all want to ensure the best standard of care for our patients moving forward. Ultimately, we hope to produce physios who are very satisfied with their jobs as well. And we do hope that you apply to Ulster University, and thanks for listening to this presentation.